Hi, I'm Katie Crawford, and welcome to another edition of Ask a Nacogdoch. Joining me today, I have Dr. Brian Glymph, OBGYN. Welcome.
Glad to be here.
Today, we're going to be talking about women's health. And Dr. Glymph, would you talk to us a little bit about women's screenings?
A lot of times we'd like to see patients before they go to college. So we talk to them about maybe their needs with birth control, if they're having any problems with their periods, if they need any kind of screenings, if they finish their HPV vaccines. But typically, we don't do pap smears until they turn 21. Those are the recommendations. You know, we will start seeing people on an annual basis at 21. And depending on their history of the pap smears and where they've had any abnormal pap smears, we can adjust that schedule as we need. Typically on those visits, we'll talk about contraception needs or any other type of screening needs that may occur that they may request at that point.
Dr. Glymph, when a woman has a positive pregnancy test, what is the next step for them?
So typically we get the phone call, they've got a positive pregnancy test and they want to know, when do we come in? We'd like to see them fairly early to go over any risk factors they may have, whether it's any health problems they may have or medicines that we may need to evaluate if they want to keep taking them or they need to stop taking them. After that, we'll do an ultrasound, usually around 6 to 7 weeks, to ensure that this is a viable pregnancy in the right location. There's no significant problems. We'll also get some firm dates with the pregnancy. But certainly we can see people earlier than that, you know, if they have any bleeding, if they have any problems, any questions at all.
Thank you, Dr. Glymph, for joining us today for another edition of Ask a Nacogdoch, and we appreciate you guys for tuning in.